Good afternoon. I'm Heather Venegas, and you're listening to King County Recovery Conversations, a place to celebrate recovery and help break the stigma of addiction and mental health. Today, I'm joined in the studio with Kimmy Reedy, and I'm so excited to have her here with us today. Welcome, Kimmy. Thank you for joining us.
Thank you for having me. I'm excited to be here.
And I really love how we've rocked the summer flower patterning going on. We're both in sandals. Yes. We have flowers. I'm wearing a floral dress, and Kimmy's in a floral shirt, and we have flowers on the table for those of you who are listening. And it was entirely unplanned, but we got summer in the house, so I'm grateful for that. Would you start us off by just sharing a little bit about how you got here? How did we end up here, Kimmy, sitting together in Orbit Audio today to have this conversation?
Well, first off, I want to say it is a total get-to moment for me. If you would have asked me 8 years ago what I would have been doing, this would not have been it. Addiction and being out in the streets was absolutely my lifestyle. It had come to a point where I was federally indicted, and I thought to myself, I know how to jump through the hoops to at least maybe have a lighter sentence when I get to court. I put myself into detox and treatment, and then I went through intensive outpatient. And somewhere along the lines between me being in the treatment facility and coming out, I had an aha moment of, this is a completely different life, and what the heck have I been doing this whole time, right?
How old were you?
Oh, wow. Let's see, I was 42. I was 42 years old. I had lived a life completely of gangs, drugs, guns, violence. And so that's what my children were brought up in. And we've come, we're coming full circle now. As you know, lost my son, Adam, May 23rd, 2023, right around the corner. He was shot and killed.
Sorry.
However, when he was living at the OK Hotel Apartments, he himself was finally off federal paper for the first time in his adult life. He was attending meetings at the garage by himself. He had come to me and picked up an NA Big Book and the workbook. Mm-hmm. And he was working on trying to get into some kind of recovery house when all of it happened. So, I mean, it's a sad story, but it's really not, because for everything that we had gone through together as a family, I'm really about breaking the cycle. Right. And when he was in prison, found out that I was actually sober, he had to call me to verify, because he was like, "Mom," and I'm like, "Yes." And he's like, "Oh my God, you really are sober." And I'm like, "Well, what do you mean?" And he's like, "You sound sober." Mm-hmm. And you never really know that there's a difference, right?
No.
So he's like,
I was fooling everybody.
Right? Yeah. So he's like, "I see you and I'm coming. I want to be like you when I grow up." And he's just kind of, he followed that. But, other things happened, and here we are. So it honestly just has brought me literally full circle, because it has just reignited that flame in me that makes me want to be of service, that makes me want to be a part of the solution. And I'm truly grateful for where I've landed. When I first got sober, I was cleaning churches and, other people's houses in the program, because I was a felon. Not only was I a felon, I was a felon under federal release. So I was pretty much employable, unless it was like a McDonald's or, minimum wage job. Didn't really have a lot of belief in myself at that point, early recovery. Yeah. Have to learn how to love myself and believe in myself as well. So I was doing that. And then I took a job with Pioneer Human Services in Spokane, Washington. So I was a monitor for the Phoenix House, which was for co-occurring folks. And I was working there for quite some time when a friend of mine told me about the certified peer counseling modules. Mm-hmm. And this is back when it was at DSHS. So prior to the move to HCA.
Healthcare Authority.
Yes. Healthcare Authority. I forget all those acronyms. And then it took me, I looked at them and I played with them a little bit and, kept going back and doing one here and there. And it took me a year to complete the modules because I was like, but I like my job. I like what I'm doing. And they're like, however, you're already doing this work. You just don't know it yet. Mm-hmm. So I got my certified peer counseling, went through the class, got my certificate, and I applied at ABHS, which is American Behavioral Health Services. It is the largest for-profit treatment facility in Washington State, and they hold the DOC contract. So by rights, I should not have been there because when I went there, I think I was barely under 1 year sober. So they asked that you be 2 years sober and off any DOC, any paperwork. Well, I was still under federal release. Mm-hmm. So they said, nope, we want her here. And they cut all the red tape. And I started working there and I became their lead certified peer counselor. Had to teach them what that meant because they thought it was case manager. And I'm like, well, I can do that. However, this is what a peer really is. So I'm like, I'm not a counselor just because it says that, and had to tell them all those things. Worked there for a very long time, got a scholarship to the Peer Pathways when it was in Tacoma, got a scholarship there, and that's where I ran into Josh Wallace.
I was at that conference.
Were you?
Yes.
Yeah, so I ran into Josh. We started talking, and he was talking about Peer Seattle, so I approached him in the Quiet Lounge, I think is what it's called.
Yes.
He was there. Beverly Miller was there. And we just started talking, and he was talking about opening up a Peer Spokane. And I thought, this is where I want to go. So they were looking for a building. I stayed in the loop, in contact with them. I became a volunteer and then a group facilitator. I applied for a job when they first started hiring, and I did not get the job. I was like, okay, get some more experience, right? So I was still at ABHS and still working at Pioneer Human Services, I should say that. So I had 2 jobs because I was like,
and
back
applying
and forth.
for a third job.
I did.
Like we never do that.
I know. It was my trauma response, staying in motion, not having to deal with things. So eventually I reapplied. I was hired on as their housing specialist. It was a great opportunity. And then more things just kind of doors were opening. And like I told you, it was kind of like the pathway was illuminated and I knew where I needed to go. So I went on blind faith, scared to death. I remember driving in my car, my whole car loaded up, and I'm just crying to my higher power, like, this is me. I'm going out on faith. Here I go. And, I couldn't be more blessed in what I get to do. So I moved up here to Peer Seattle.
So that's where you went.
That's
crying in blind faith.
Yes, and that's actually where I met you.
Exactly.
Yeah.
And had you set off with all your things yet, or were you still in Spokane when you got nominated?
I was in Spokane when I got nominated.
Okay, so a few years ago during COVID,
yes.
We didn't do Recovery Day at the Mariners, and we weren't going to be doing the legislative forum, and we were trying to come up with, what can we do to bring our community together at King County Recovery Coalition when we're not meeting, and how can we, infuse and uplift our community? And I noticed that there was a lot of news pieces and articles and things and shows around the frontline workers during COVID, and which absolutely everyone deserved every single shred of, appreciation and gratitude. And I noticed that, hey, what about behavioral health frontline workers? Because I'm not hearing about them, but I knew that people at Recovery Cafe were serving lunches, every single day during that time. And they served some insane number, 50,000 meals during the pandemic.
Yes.
And so many places people were being served. And so we got the idea of Gratitude for the Frontlines to put a call out to our community far and wide through every single community partner or organization or social media account and friends and, 12-step groups, everybody that we could come in contact with. And it kind of went all over Washington. And we were just like, hey, if you or a loved one have been touched by someone who is a behavioral health frontline worker, we would like to hear that story and help you express gratitude to them and just kind of lift these folks up. And so we got I think 70 personal nominations for frontline workers. We got 17 organizations that were nominated, and we took care packages to all the people that were nominated in a couple of places, Recovery Cafe, and then also Evergreen Treatment Services in Renton. They had a lot of folks that were nominated, so we took lunches in. Nice. And we ended up doing a webinar around it too. And so that's how I personally met Kimmy. Yep. She was one of the people whose stories I got to read, this incredible behavioral health frontline worker angel. Yeah. And she ended up coming to Seattle. Did. So tell the rest of the story. Sorry.
Well, yeah, and the funny piece about that, Heather, is that I was nominated by a fellow coworker, Julie Hinkemeyer, who still works at Pierre Spokane, and I was unaware of it. Mm-hmm. So I was completely unaware of it until I had gotten here. And then I got to see the email that she wrote, and I started bawling. And I thought, she's not describing me. Because, I don't know what it is, but part of me was still holding on to that who I was in my addiction, not who I'm becoming, right? And it was an eye-opener, like, oh, okay, I maybe I am making a difference, But like I've talked to you many times, I try to divorce myself from ego daily because it's a very slippery slope for me with my ego. Like I'm all that in a bag of chips when really I'm just one cog in a wheel, right? That's how I have to right-size myself.
So personally, I'm really interested. Kimmy, tell me how you do that. How do you unhook yourself from your ego? And for our interested listeners as well.
I try to remain humble, and I remember it's not so hard to do, especially I live on Capitol Hill. Right. And it's not very hard to do because it's very easy for me to walk out and see somebody sleeping in my doorstep or, in the alleyway to work, people trying to climb up and use the bathroom somewhere that's not the street. And it's so easy for me to remember that we are all one choice away from an entirely different life.
Absolutely.
And it's hard because you see all of this and it's growing, right, with the epidemics. And I don't know, it's just really hard. So I try to remain humble and remember where I come from, which is part of my story. I told you that part of any promotion that I get within the organization, I ask that I remain on the front lines, that I am able to still get in the car and go help people, meet them where they're at, because that's part of me remembering who I am. So I don't forget where I come from. But yeah, I try to remain humble and remember, the problems that I have today, I prayed for them once upon a time. And I have a roof over my head. I have money to pay my bills. I can eat. I'm able to get in the car and go if I need to, things like that I took for granted. And I just don't do that anymore. I can't. There's too many people that go without, and it saddens me. So that's how I keep myself removed from ego and check in. I also get up every morning and I say 3 things that I'm grateful for, and they are always grateful that I opened my eyes, grateful for all my trials and tribulations that led me right here, right now, and truly grateful to my higher power for never turning his back on me, because I sure ran hard and fucking fast from him. So, yeah, that's how I do that.
Beautiful. There's something to that, I think, too. Starting every day fresh. I do a gratitude practice in the morning too, and I write it. I journal mine to my higher power, and I always start with, I'm so grateful for this new day, another day in recovery, and in this new life that I'm so blessed to live, and for all the opportunities and blessings that I have, and not just that I get to receive, but then I also get to share back out into the world, and
which you do amazingly, by the way.
Thank you.
Just got to tell you that. I always love seeing your face. It's like, oh, yep, nope, we're not alone. Yep, we recover out loud. So that got me to the point of being at Peer Seattle. And then I helped build out the foundational community supports for housing and employment through all of our brick and mortar sites, which is Peer Spokane, Peer Seattle, Peer Kent, and Peer Olympia. I became a program manager, which I thought, wow, that was the top of the cake for me, federally indicted felon. I have college background, but I have no college, certifications or anything. I didn't finish. So I'm feeling in my prime at that point, I'm really helping people. I'm making a difference. I'm plugging in wherever I can because it takes a village. And I think that more of us need to get together instead of going against each other.
Yeah.
The politics need to stay out of it. These are human beings that need our help. And yes.
I'm curious. I was in a conversation, a couple of them recently in the last month, and this was actually a sentence or a theme that I believe that I heard there. Are you referring to like going against each other, like different community partners and organizations?
Yeah. There's a lot of politics that happen, and I'm a collaborator. You know what? I don't care about our politics. Let's put that aside. I care about people not falling through the cracks because it happens too often. Mm-hmm. I also, work to help establish FCS at ABHS, American Behavioral Health Services, because that's the piece that's missing, right? A lot of folks go to treatment, but then we put them, we tear off that Band-Aid, open up that wound, and put them right back into the same environment that they come from. So the housing piece was essential. So when I was at ABHS, I made sure that people were at least getting into Oxford or AHA or, whatever reentry. It's WELD reentry up here. It's Revive reentry in Spokane, just wherever I can connect.
So that people are having ongoing recovery support services wrapped around them.
Yes.
Yeah.
So,
like we do for people that are cancer patients, or if you have a mental health challenge or something else.
You have hospice, you have your mental health provider, you have group therapy, you have, So it's the same thing, right? Because addiction is a disease. You can debate it all day long. The bottom line is this. We still need that support network. We do not have it. We don't even know about it. And we're scared to reach out and be vulnerable at first. So all of these things built me in, right? And then the Blake decision happened.
And could you explain what that is very briefly for our audience that may not?
The Blake decision was a bill that was put forth and was approved that instead of people being arrested for low-level possession, they would get referred to services instead. So when that first happened, King County was the last to be implemented. It's a Washington statewide, and King County was the last. So it started back in 2021. We didn't start till June of 2022 here in King County. We have built that up, and it is taken on a life of its own now, which is a beautiful thing, I think. It's based off of law enforcement diversion, right? So people are not getting arrested and getting caught up in that cycle, and costing lots of dollars. As we know, it's like $13,600 per person caught up in jails and courts. And that's, it's like $136,404. I don't know the exact number, but something like that annually per person. So we started this, and it's law enforcement diversion, and it's community courts. And now we are also receiving referrals. We work hand in hand with Lieutenant Gepner at Score Jail, with Kirkland. So we tell the officers, we want to be a tool in your tool belt, right? You're supposed to be here to serve and protect, not to house and diagnose. That's not your job, but it's getting thrust upon whomever, right? Because we didn't know what to do for a while. So based off of all of those things, we also now are taking referrals from people re-entering from prison so that they don't just get their gate money and a ticket and back to the same thing.
Right.
So it's just this amazing program. So that was built, Lauren Davis fought for it. We've all kind of got on it. It's been, redid here and there. But the bottom line is this. We are working with law enforcement. We are working with EMTs, firefighters, first responders. We go into hospitals. and we really get to show up for people, right? I've had so many people come back and say, man, I'm so grateful this program was here. And I have people that work for me that say, man, if I had this when I was out there, it would have been a lot easier, you know? And I just think what a blessing it is that I am in the position I'm in to be able to help foster this. But I also feel blessed that I have supervisors like Cody West and Josh Wallace, who are not just coaches and mentors or bosses. They are true voices in the peer movement. And I'm just in awe most of the time. I really am. I'm like, this is my life. Yeah. Yeah.
Pretty amazing, isn't it?
It is more than amazing. It's more than I could have hoped for. You know, I would tell people all the time, stop settling. You deserve more than this. You're worth more. You know what I mean? And I would say it so much that I finally started to believe it about myself. And I think it's the truth. We settle, right? We do a lot of things based off of circumstance, I think, in our addiction.
Could you tell our audience the name of the program that we're talking about?
Absolutely. It is the Recovery Navigator Program with Pierre Washington. We are in King County, except for 3 places: Burien, White Center, and downtown Seattle. That is lead RMP. So when I say Recovery Navigator Program or RMP, statewide, it really is statewide. We work hand in hand with other RMP organizations in different counties based off of needs. We had a young lady who was 8 months pregnant, and as we know, detox for somebody who's pregnant that far along is very hard. We do happen to have one up in this area. So Yakima called us, transported, we picked her up, we got her to detox, we took her back from detox and got her back home. And that's what I'm saying by it takes a village, and it takes collaboration. And most of the King County RMP is based off of relationships that we have. It's not about what programs or resources you know. It's about who you know in that program, who you know that works at that organization, and fostering those from law enforcement to detox to treatment to housing. You know, we work with employers. Yeah, we just we go and we vet these places individually because not everybody's the same. RMP is not a cookie cutter program. It's very individualized. It's tapered to the individual. It's also volunteer. It's not forced.
Sorry.
So people don't have to opt into our program, but we do go. So if we get a referral call from law enforcement, the way that a referral goes is that we'll get the call. We have 30 minutes to get there. We're usually there before then because we have 2 office spaces, one in Federal Way and one up on Capitol Hill, and we have 14 fleet vehicles. So we have a good span at, hitting wherever we need to hit. So law enforcement will call us with, somebody that they're going to arrest, but they want to bring us in. So we'll go pick that person up. We take them away from law enforcement, and then we have a conversation. If they need a meal to eat, we'll get them something to eat, something to drink. And it's, I call it, we swoop, scoop, and stabilize. So we swoop in, scoop them up, and then we stabilize whatever their immediate need is, whatever the crisis is. And then, we have funding from King County, which allows us to put them into a hotel that we have a partnership with. It's not a free-for-all. They stay there, 1 to 3 days, depending on. Because normally we can get people into detox same day, never longer than 3 days. So we want to take them away from the area that they're in, because it's a small window of opportunity, as you know. And,
absolutely.
And we're meeting them probably at their worst moment, right? Law enforcement, I'm going to have a charge. Here we go again, whatever. So we take them away from that environment. We have somebody that goes and checks on them daily, so they're not alone for the entire time. And we get them food every day, or, hey, what do you want to work on before? What are some of your worries? If they have animals, we get them into foster care until they get out. We have even gone as far as following somebody all the way through treatment and out. They get back out here and realize, I don't have anybody here because I'm not from here. I migrated here because I followed a boyfriend or something. So we have the availability to also help folks reunite with families. We sent a mother home to her children in Florida recently. That was amazing. She sent pictures of her and her kids and her parents, and the parents sent thank yous, and it's just what we get to do, right? And it's not us. Like I have to remind everybody, you're telling RMP thank you, but I want you to look in the mirror and say thank you to yourself. You showed up for this. You agreed to this. You did the hard work. We just want to help patch in, the rest of those resources and natural supports for you. So, yeah.
That's wonderful.
Yes.
I was going to ask if you had any stories to share about people that have been through the program.
We have so many. One of my best ones, I won't say any names. They will all know who I'm talking about. We had our very first, he wasn't the first RMP participant, but he's our first RMP participant to go through the RMP program. Get sober, stay sober, do all these great things, stay in contact with us, and then apply for a job. And we recently hired him. So that's one of our biggest successes because we like to bring people up through services. Right. Because who knows better than those that have gone before us, right?
Absolutely.
So that's one. We have so many, though. We have another employee that I began working with when I was employed with Peer Seattle in the housing department, who went through detox treatment, became a volunteer, then started working with Peer Kent. And as soon as RMP, became a thing, Pierre Kent was nice enough to allow me to steal him. So there's another one. I mean, just within our own ranks, we have a lot of success stories. But one that I remember vividly was a man in Federal Way. He had been living in encampments, wherever he could make a space in Federal Way for like 13 years. Law enforcement called us, right? And they were like, listen, give it your best shot with this one, but we don't expect anything because he's been here for 13 years. He's going to tell you what you want to hear, this, that, and the other thing. Well, that was a year ago. That man has gone through detox treatment, housing, is now employed and been reunited with his daughter and is still sober and still reaches out just to let us know, check in, on how he's doing.
That's amazing.
Yes. So
thank you so much for taking the time to come.
Thank you for having me.
Meet with me today and share a bit about your journey and about this amazing program that you are blessing our community with. I'm so grateful. And
thank you.
Thank you to Josh and Cody and all those for allowing you to come.
Yes, thank you.
They've been a part of my cheering section too.
Then firsthand.
I do. They're amazing. Yes. And so, okay, one of the things I was going to talk about next, what's coming up in August, like what recovery news do we have? And I'm thinking August 31st is the International Overdose Awareness Day. Mm-hmm. And so there'll be a lot of different events and activities that are marking that and creating a space for people to honor those they've lost. We have a podcast we did a year ago in August on that topic with Brad Finegood and Millie.
I saw that one.
That's wonderful to listen to, stories of loss and hope. Yes. But Pure Pathways is coming up. Mm-hmm. Are you going?
I am going. I am taking a few members from our North and South offices. Very much looking forward to it. It's going to be in Yakima this year. So, yeah, very much looking forward to it. Going to be there and, yeah.
That's fantastic.
Yes. Also, I just wanted to let everyone know, because RMP, we are open 365 years a day.
Days a year.
Days a year, sorry. Yes, thank you.
That would be a lot of years in one day.
You know what I mean.
Some days
Scratch that, reverse it. No. Anyway, so 365 days a year, 7 days a week, holidays included, 9 a.m. to 9 p.m. 2 days, as of 2 days ago, we expanded our hours. We are now 9 a.m. to midnight. So we are looking at going into a true 24-hour 7 model. But the need, it's got to be shown that the need is there from law enforcement, which I'm sure we will, because this last month was our biggest month since we started. We received 104 referrals last month. So just wanted to put that out there.
Incredible. Mm-hmm. Well, we'll have all the resources listed in our show notes. That'll be available on Spotify, on Apple Podcast, and anywhere else you find your podcast. Coming up in September in Recovery Month, we have Recovery Day at the Mariners on September 15th. There's going to be all different kinds of activities. There's a recovery rally, a march to the game. Yes. There's all the things that happen with our pre-event in T-Mobile Park and then during the ball game. If you'd like to find out more information, you can look at our King County Recovery Coalition Facebook page. You can email me, heather@kcrecovery.org. And if you want to buy tickets, go to mariners.com/recovery for the tickets to the ball game. That part isn't free. The rest is. So I just would like to say thank you again to Kimmy for being here with me. And thank you to Orbit Audio and for the generous support of King County Behavioral Health and Recovery Division that helps make this podcast possible. And until we meet again, be well.
Thanks, Heather.
Thank you, Kimmy.